is what we do. Medicine is about health, and it's also about unhealth. Okay, so okay, so this is the flag of Guyana. Does anybody know where Guyana is? It is not in Africa. So I thought it was in Africa, and I was going there to work, and I was making the flight arrangement, and I discovered that it's in the same time zone that we're in. So it's in South America, it's directly south, and it's very close to borders Brazil, it's on the ocean, it's a Caribbean country. And basically, Guyana is the third poorest country in the Western Hemisphere. So this is me, Jillian Battino. I go by Jill. John Vaccaro is my partner who works with me in Guyana. And I'm going to tell you about how we put this together. Okay. So the organization that I work with has about 12,000 volunteers, so it's huge. It is an official affiliate of the United Nations and the World Health Organization, and we work in countries all over the world. So it's a very big, very busy organization, and it is filled with not just radiologists, because we can't all be doctors, and we can't figure out radiology if we're all just doctors. We need technologists, we need nurses, we have physical therapists, occupational therapists, we have IT specialists, so people who are great with computers, we have managers, we have financial advisors, we have lawyers, we have artificial intelligence developers, all kinds of things that are brought together to create a functional program. And so this is a culmination of different types of Rad Aid projects. And so this wheel basically represents what we have in Rad Aid and what we pull together to make a successful project. Okay, so Guyana is a tiny little country. It has 800,000 people. It's classified as the third poorest country in Latin America and the Caribbean. They speak English there, so I did not need my Spanish, which is good because it got really bad over the years. And they speak Guyanese Creole, which is a really cool sounding sort of English. You know that they're speaking English, but you can't understand what they're saying. It's fun to listen to. It doesn't work well for me. And they also speak Amerindian languages. So this is Guyana here. This is Suriname, Brazil over here, Venezuela over here. And so what we do is we wait till we're invited. You don't want to show up and be an arrogant, know-it-all American and walk in and say, your medical care sucks and people are dying unnecessarily and I'm a smart American and I'm going to fix everything. That is an old-time, unsuccessful, horrible way to practice intervention in the third world. So what you do is you wait till you're invited. So we were invited to Guyana in 2015, and they said, we would like you to come down. They didn't tell us why. They said, we just want you to come down and see our hospital. And so I went, myself and 3 other radiologists, all of us radiologists went down to have a look-see. And we did this radiology readiness assessment, which basically means that we're looking at, can you do radiology in Guyana? Do they have electricity that's reliable? Do they have internet services? Do they have a CT scanner? Do they have an ultrasound machine? Do they have doctors who can read this stuff? If I diagnose breast cancer, can somebody fix it? Or is it just going to be diagnosed breast cancer and the patient still succumbs to their disease? So radiology readiness was performed by a resident who has since then finished her residency program, and she works at Harvard Medical School, and she is an interventional radiologist. And what we learned, basically, just what matters in the green and red. The good was that there was a radiology department. It really didn't have much in it. Everything was broken, there were no doctors to read the film, were still using film, whereas these days we use computers for all of our stories. And they sort of had a radiologist, less than one radiologist full time. And so after our visit, what they told us was that they wanted a radiology residency program. So do you guys know what a residency is? Y'all watch Grey's Anatomy, right? Okay, yeah. So residency is a postgraduate training program in a specialty. So when we say OBGYN, or we say surgery or urology or radiology like me, that means that after you're done with your medical school, you're basically prepared for nothing, okay? You know all the science, and you know the names of the drugs and how they work at a cellular level, but you don't know what to do with it. There's no experience with taking care of patients, so you have to go into a residency. And they had no radiology residency in the entire country. So there were 0 radiologists in the entire country, a country of about almost 1 million people. So we started a residency training program. I wasn't really qualified to do this. I went to residency, but I've never run a residency program. So we worked with other institutions to put together a residency program. And we did that in Queens, New York, at the Hofstra Northwell School of Medicine. We recruited 5 residents. These are them down there, the first 5 radiologists in Guyana. And we got a grant from Philips Corporation. You guys know Philips, right? They make hair dryers, and they make CT scanners, and they make ultrasound machines, and all kinds of other stuff. TVs? What would you guys know Philips makes? Does anybody know? I think everything, Everything in radiology. So they gave us a lot of money, and they also gave us 2 CT scanners. And they said, you can put these CT scanners in Guyana, and we want you to train radiologists how to read CT. So these are the 5 that we selected, and we sent them up to Queens to live for 6 months and watch radiology. So in the US, I mentioned that the residency training is 5 years. In Guyana, it's 3 years, and that's because there's no MRI in Guyana yet, so we're not training people to read MRI. And there's no nuclear medicine in pretty much the whole of the Caribbean, so we don't need to train nuclear medicine. Also, interventional radiology is minimal, so we didn't need to train that. So we could reduce the length of the residency to 3 years. This is Georgetown Public Hospital in Georgetown, Guyana. So usually, for my generation anyway, and older, when you talk about Guyana, they think of Jonestown, the Kool-Aid thing. Remember that back in the 80s?
Oh my gosh, I know that.
There was a really horrible cult-like thing that went down, and a whole lot of people died.
Yeah,
And this was in Guyana.
Oh, that's serious. He poisoned with Kool-Aid.
Yeah. So that's where the drink the Kool-Aid thing came from. But they don't like to be reminded of that, obviously. So this is Georgetown Public Hospital Corporation. It looks pretty nice, I think. It looks pretty good. And this is the maternity ward. So in the maternity ward, so these 2 ladies, actually maybe not these 2, but some of these people are sharing a bed. So you'll actually find 2 patients and their babies in the same bed. It is very crowded, it's very understaffed, and medical care is limited, and it's very challenging to take care of people there. So these 2 ladies are definitely, see that one? 2 ladies and a baby in that bed. They have 1 ultrasound machine. It doesn't work very well, so definitely lots of challenges. And you can see how if you're in that bed over there, it might be difficult to get there if you've just had a C-section or just popped out a baby, right? You climb all over these beds to get there. So that's what the hallways look like in the radiology department. And this is at about 6:45 in the morning, so they don't do any appointments. You just come to radiology and you say, I need an x-ray, and you give them a little card. There's no computers. They may take the x-ray. It may not work out very well. They might take it 2 or 3 times. The table that they take the x-ray on is not likely to be clean because they're so busy that they have a difficult time getting things cleaned and keeping patients moving through. So there was a lot of room for improvement. So we started, right? So this is, I found this room in the middle of the department. It was actually a closet, and it was full of junk on that side. And we moved all of the stuff out of there. We got a huge donation of computers. We brought internet in there. We brought what's called a PAC system, and that stands for Picture Archiving and Communications, and basically what that does is allows us to look at pictures from the CT scanner on those computers, and this is the first residency class sitting there trying to figure out how to read a CT scan within the first week of the residency program back in Guyana. That's a fluoroscopy machine. Has anybody ever had a fluoro study? Ever drinking like white paste? See if your esophagus is okay. We do it with babies a lot. Nobody? That's a fluoroscopy machine. This is Dr. Angelita Sue and John Vaccaro, my partner, and they're wearing lead to protect them from the radiation so that they can perform fluoroscopy. This is the first CT scanner for the public health system in the entire country. It was donated, no, this one was purchased, it is a Philips scanner, and these are the first technologists for the public health system in the entire country. So that was 8 months ago, 10 months ago, they got their first CT scanner. This was done maybe a couple months ago, and it's a cardiac CT. So this is a very high level technology type of CT. So they went from not having a CT scanner to having a CT scanner, a residency training program, having specialists come down from Columbia University. Do you guys know Columbia University? It's a hoity-toity place, you know, like a little ivory tower place like Harvard. We have people coming from Harvard and Yale and Stanford, Ohio State University, University of Cincinnati, University of Wisconsin, coming down to teach. So they went from not doing CT to doing cardiac CT. So ultrasound, going from not knowing how to do an ultrasound. This is Brenda Hall. She works at Emory University in the South, where is that, Atlanta? And she came down and spent 3 weeks teaching people how to do ultrasound. This is a lady named Radha Persad. She's Guyanese. She immigrated to the US when she was a kid. She's an ultrasound technologist in Queens, New York. And she went back to Guyana to teach her people about how to do good ultrasound.
So Jill, they just recruit some people to come for a short amount of time during that residency? Is that how that works, or?
So what we do, initially, we had to have someone there all the time.
Okay.
So that's my job. I coordinate all of this. So I spend probably about 35 hours a week
And
on
you're not
top
getting
of my
paid for
regular job. And I do not get paid for that. No, that is volunteer work. And it's way more fun. And this might sound crazy, but it's way more fun to do something because you want to do it, as opposed to doing something because I don't like to be bossed around. I mean, don't most of us feel that way? I don't like to be told, you gotta be here, you gotta do this, you gotta sit in that seat and read those mammograms. I like to be creative with what we can do, and this is what we do. So yeah, we have to recruit people from that data bank of 12,000 volunteers to come down and get grants from all over the place to fund some of this stuff. A lot of people pay for it themselves. And so, yeah, this is some of the second-year residents, and those are the first-year residents. We now have 11 residents. So we need 80 radiologists in Guyana based on the population. So these guys here, this is Dr. Eric Goodman, and that's Joelle and Dolwyn, and they're senior residents now, and they're using, he's basically teaching them how to do knee ultrasound. That's why took me forever to figure this out. I'm like, why is he wearing shorts? That's so inappropriate. But he's wearing shorts because they're learning how to do knee ultrasound and ultrasound-guided introduction of steroids for therapy into the knee. So they don't have MRI, so we need to be resourceful and figure out what we can do to treat a degenerative painful knee, or to take pus out of a painful knee, or to take fluid out of a painful knee. This young lady came from Austria. So we have a lot of international volunteers. She came from Austria, and she spent 3 months in Guyana. She's a third-year resident in Austria. This is they're teaching how to do ultrasound-guided biopsy, and what we do is we take a chicken breast, cut it open, we stuff an olive in there and smash it all together, put your ultrasound probe on there, get a biopsy device, and biopsy the olive, so that you can do that before you do that to somebody's breast. Interventional radiology, so this over here, I don't know if you noticed in the first set of pictures, all of the procedures were being done by people who were there to teach, and this is 3 years later. The person who is teaching is Joelle. Here, I probably can do this with this, right? No. All right, so Joel is teaching, he's a senior resident, so he's now showing, so this is called Teach the Teacher, and it's a mechanism of sustainability, right? If I drop in and I pull your tooth and then I leave, then your tooth is gone and that's it. But if I drop in and I show somebody how to pull the next tooth, then when I'm gone, the tooth can be pulled. And that's what we're doing. We're building sustainability through education. That's what you're doing every day. So this is a big lung cancer right here. And this is a needle going into the lung cancer to get tissue for a diagnosis. This is a renal cyst, so one of the things that we fight down in Guyana is just differences in knowledge base. And it is simply a matter of underexposure, so we're trying to expose them. So that's a renal mass, but it's a benign renal mass, meaning it's not cancer. They wanted to take this patient to the operating room, make a huge incision in their abdomen and their flank and cause a lot of pain and morbidity and mortality risk. And we were able to put a needle in that and drain it and show them it's just a cyst, just you don't have to do anything with it. How much time do I have? 2 minutes?
No, we go until 5:02, so you have 12 minutes.
All right. Women's health, so this is, probably the most important thing in my view, because it's what I do. But basically, if you look at the World Health Organization and what they look at to measure the health of a country, they look at two major parameters, the health of women and the health of children. Because, like it or not, that is the predictor for the future, right? Men can't have babies, and they don't take care of children in general society. So those two things really indicate how are women treated, that's another indicator, and how healthy are women, how healthy are children. So in Guyana, when I arrived in 2015, there was 0 mammography at all, so no breast cancer screening for the public health system. So the only way you could get a mammogram is if you were rich, or if you were going to Miami, and then you were also rich. So people who are normal people could not get mammography. And so, of course, we were looking at that from the very beginning. How could we address this? And so we got a mammography unit. This one was purchased by the Ministry of Health. And this is our team. That's one of my doctors here, Angelita. This lady came from Miami to train. And these are all the technologists. This is a physicist right here who has to maintain the equipment. So we have to teach the physicist how to maintain the equipment. We have to teach the technologist how to do QC checks and make sure that the patient isn't getting too much radiation, and how to properly position the patient for the imaging. And then we have to teach Dr. Sue and all of the residents how to find the breast cancer, how to biopsy the breast cancer, and how to manage the breast cancer. This is technologist training for the CT scanner. That's Richard Fugillo, who is an international radiologist. And he came down for 3 weeks to teach the techs how to use the new CT scanner. This is me with no hair a couple years ago, and all of the CT techs that we were teaching at that time. And this is more teaching. So this is a lecture going on in the middle of the reading room, and more teaching. So it's all about education and passing on what you know so that they can take it and run with it, have their own successful program. And then picture yourself here. This is a lecture that we're going to be giving in 2 weeks or a week and a half, again at the Pan American Health Organization in DC, and we're trying to recruit volunteers. But I also want you to understand, I've taken college students, I've taken residents, I've taken medical students, and I'd be happy to take a high school student who is interested in going down to see it. So truly, if you are interested, you should definitely get a hold of me. It's out there, it's available for you, and we can figure it out. We can figure out funding for you, and it would look dang good on your medical school application or your PA application. Nursing school is super competitive these days as well, so it looked great on there. This is nursing. So I know this picture looks like it was taken in the 1940s or something, I think anyway. You guys remember the 1940s, right? So this was actually taken about 2 weeks ago. With a low quality phone. And this is what, you still have to dress like this if you're a nurse in Guyana. And these are the nurses that came down, and they are teaching resuscitation and management of contrast reactions for radiology. And and also something called ACLS, which is Advanced Cardiac Life Support, another form of resuscitation. More nursing education. And this is our residents, again, Joelle and Dolan, learning how to resuscitate a dummy. And then for those teachers out there, we had to put together a curriculum. So basically, I had to go to all of these different institutions and say, do you have ultrasound lectures that you would donate on these topics? And we put those all together on an accessible website so that our residents have a curriculum from which to learn. And this is them watching their curriculum. They have projected education time, 2 hours, 2 days a week. And then they take scary hard examinations. And the residents also do presentations. So far we've had residents present at national meetings in Guyana, also travel in the Caribbean and present. And one of the residents even came up to the US and presented at the DC meeting last year. So we're teaching people to be leaders. We're teaching people to take over. And the point is that in a year or two, we should be able to start pulling back and they should be stepping up. And in 5 years, it'll be their program. They will be doing the education and we'll just be there to support them as they request. Informatics. Okay, so this is Hansel. Does Hansel look cool? I think he looks pretty cool. So Hansel is the first Rastafarian I've ever met. He's a real live Rastafarian. Do you guys know what that is? Do you know who Bob Marley is? Okay, so he is a real Rastafarian. He's got dreadlocks down here, doesn't eat any meat, and he is like super chill. You can barely hear him when he talks. And he's a brilliant IT guy. He runs all of the IT impact stuff at that hospital. Geeks wanted to help us run our stuff. And then this is also sort of a Geek Squad kind of area. Currently what we have is 3 CT scanners in different parts of Guyana, and they are connected over the internet. And actually right now I could log onto my computer and show you guys a CT scan or a mammogram or an ultrasound from Guyana because Google, so Radian works with Google. Google has donated a large amount of cloud space that allows us to develop interconnectivity and store data so that I can access it from the US. So if they have a CT scan on a kid and they need assistance with it, then they would call me up and I would look at my list of 12,000 volunteers and find a pediatric radiologist and I would email them and I would say, hey, pull down this study and tell us what you think. So it lets them get the best care from utilizing resources from all over the world. This is these girls going to school. I think we have it rough in the US. This is the school bus in Guyana. And this is more remote regions of Guyana, more remote regions. And this is the reference to the cloud. And this is Dr. Vaccaro's reading station in New Hampshire, where he looks at his stuff. I have the same thing at my house. And this is Dr. Vaccaro on an airplane at 35,000 feet. He got a text. You're allowed to do that on airplanes these days. Could he look at a case? He opened it up and he was able to look at that case on the airplane and give some feedback. And then we're also doing AI work, and this is super cool. So basically there's development in artificial intelligence in medicine, and basically they're creating software so that you can utilize the software in the interpretation. And right now the research is ongoing, and our residents in Guyana are doing some of that research through a couple of different companies